Welcome back to 12 Days in March. In this final section on oral lesions, we'll review the neoplastic lesions you should be familiar with, followed by some sample questions. Although malignant neoplasm is the last topic of this section, it certainly isn't the least important. The most common oral cancer is squamous cell carcinoma. It accounts for 90% of oral cancers. You will need to be familiar with predisposing risk factors, including the close association between HPV-16, and whereas this is a close and important association, it is not the most common risk factor. Tobacco use, alcohol use, and the synergistic combination are the most common and preventable risk factors for oral cancer. In terms of presentation, an oral ulcer that does not heal, bleeds easily, or persists for over 2 weeks should raise the suspicion of a malignant neoplasm. Similarly, an unexplained mass will require further investigation, including biopsy. You need to be aware of the pathologic description of squamous cell cancer. Whether in the mouth, lung, skin, or esophagus, these lesions will be described by the presence of keratin pearls and intercellular bridges. When they mention or show you a keratin pearl, the vignette is telling you the patient has squamous cell carcinoma. Alright, that was quite a journey. Before moving on to Section 3 of the oral health topics, let's pause for a few sample questions to consolidate this material. Question 1. A 20-year-old female college student presents to her family physician with 1 week of low-grade fever and headache. Exam reveals exudative pharyngitis and posterior cervical lymphadenopathy. Lab testing shows a white blood cell count of 16,000 with 55% atypical lymphocytes. The heterophile antibody test is positive. Which of the following is the most likely cause of this patient's symptoms? Answer: Epstein-Barr Virus. This clinical presentation, highlighted in the question stem, is consistent with mononucleosis caused by EBV. A positive heterophile antibody test, also known as a monospot test, solidifies the diagnosis. Note the presence of posterior cervical adenopathy as well as the presence of atypical lymphocytes. You will recall that atypical or reactive lymphocytes are CD8 positive cytotoxic T lymphocytes. Instead of asking the most likely cause, they could also ask about the most characteristic complication. In that case, the answer would be hairy leukoplakia, which is pictured and described in the graphic. Recall this is an oral manifestation of EBV infection and is a benign condition. With regards to the other choices, recall that dental caries are classic for the dry mouth of Sjogren's. Leukoplakia is a precancerous condition with the same risk factors as squamous cell carcinoma. The key takeaway for choice F is that EBV is associated with malignancy, namely nasopharyngeal carcinoma and lymphoma. It is not associated with carcinoma of the tongue. Let's move on to the next question. A 6-year-old girl who is homeschooled and seldom visits the doctor presents to the pediatrician. Symptoms include conjunctivitis, cough, runny nose, and a fever for 3 days. Small lesions with blue-white centers are seen in the oral cavity. Which of the following is the most likely cause of the child's symptoms? The answer is E. rubeola, or measles, which presents with these distinctive lesions described as having a blue-white center known as Koplik spots. The patient's history of being homeschooled and rarely seeing a doctor hints at the possibility that the child has not received their measles vaccine. This vaccine is required for school-age children to be enrolled in school. Next question. A 38-year-old woman visits her physician with dry mouth, chronic mild cough, difficulty swallowing, and dry eyes for the last several months. Examination reveals low-grade fever and multiple joints are tender. Which of the following additional conditions is the patient most likely to develop? The answer is E. dental caries. This case presentation is consistent with the autoimmune disorder Sjogren syndrome. Recall that the manifestations result from the destruction of salivary and lacrimal exocrine glands, which causes dry mouth, called xerostomia, and dry eyes, referred to as keratoconjunctivitis. Her dry mouth contributes to the difficulty swallowing, and the lack of saliva puts her at a greater risk for developing dental caries. Great job! You did it! You've made it to the end of the section on oral lesions. Lots of material, but it shouldn't be too daunting given all the characteristic findings we've reviewed. In Section 3 of this series, we'll address the other key disorders on oral health you are apt to encounter on the boards, so stay tuned. If you have any questions or concerns about any of this material, please email me at 12days. Thank you.